What is your name?
My name is Mia Robinson. I am from the U.S., Atlanta, Georgia specifically, and I have sickle cell disease.
How how easy have it been living with the sickle cell disease?
Living with sickle cell disease has been difficult. As a child, I couldn't do what the rest of the kids were doing, such as jumping in a cold pool on a hot day or playing basketball or kickball with my family and friends. There were several times that I had to spend days in the hospital due to infections, overexertion, dehydration, or just from nothing at all. There are moments where the cold weather can trigger a crisis for us. So as a child, it was difficult, and even as an adult, I've learned how to manage. So I've been able to cut back on the stress, which is also a trigger, and just keep myself healthy. But it's still difficult.
Maybe for the person that is viewing us, could like to know what is the sickle cell.
Sickle cell is a genetic red blood cell disorder, which means you have to get it from your parents. You cannot catch sickle cell disease by hugging me or shaking my hand. You can only get it from your parents.
And do we have the types of sickle cells disease?
Say that one more time.
Do we have the types of sickle cell disease?
Yes, there are several types of sickle cell disease. I have sickle cell type SC disease, but the more common one is SS, and that one is known to be more severe, but to the medical profession, but all of it's severe. I've had my hips replaced, my shoulders are deteriorating, my spine is deteriorating. I have hearing loss, I have visual issues, all due to sickle cell disease.
Maybe did you being born with this disease, or you got this disease when you are already at this age?
I was born with this disease. My mother did not know that I had this disease until I was 6 months, and I had my first pain crisis at 9 months.
And how did your family respond whereby after realizing that you are born with this sickle cell disease?
When my mom found out that I had sickle cell disease, she was a little disappointed, as to be expected. She didn't know what to expect. She did not know what all could happen to a person with sickle cell disease. So she was open to learning about the disease. She connected with support systems in our community that really helped her understand the disease and really helped her know how to care for me as someone living with the disease.
Maybe we have seen quite a good number of people when they heard that somebody is suffering from a certain disease, people runs away from him. Maybe to you, how was it since your childhood?
How has it been since my childhood?
Yes.
It's been a learning process. As I've gotten older, I've realized what I'm able to do and what I'm not able to do due to this disease. And I've also learned how to avoid some pain in some cases. For instance, making sure that I'm well dressed and I'm not super cold, that I have my coat, that I have something warm on in the cold weather. I ensure that I'm hydrated at all times. I carry a water bottle with me at all times. And it's just been a lifelong learning process on how to manage it. And as I get older, my body changes. So something that helped me 5 or 10 years ago may not be as beneficial now. So sometimes I have to switch up my health management to see what works for me now.
Maybe at your age, are you married?
I am not married.
What about if you marry someone who is not suffering from this disease, sickle cell? Can you be able to transmit to him the sickle cell?
No, you cannot pass sickle cell on to your spouse, your siblings, just a friend. You cannot pass sickle cell disease to anyone. Even if you marry someone or have kids with someone who does not have the sickle cell trait or disease, you cannot give it to them. But you must be careful with who you have a baby with, because your child could come out either with sickle cell disease or sickle cell trait.
So you must be very keen with whom you are having a baby with.
Yes.
If you have a baby with someone who has a sickle cell too, so the priority of having a baby with a sickle cell is high or no?
If you have a baby with someone with sickle cell disease, it's 100% chance that your child will also come out with sickle cell disease. If you have a baby with someone who has the trait, that does lower your chances of having a baby with the disease, but that risk is still there. If someone with sickle cell disease has a baby with someone who has a normal genotype that doesn't have sickle cell disease or trait, then your child will come out with sickle cell trait.
Do you face a challenge to get a fiance, whereby when they realize that you have a sickle cell disease?
Do I face a challenge when
having a fiance, someone that is want to propose to you? Have you ever gone through such kind of a challenge?
Yes, when I was dating, I'm very open about my diagnosis, because if a friend or a partner wants to be close to me, they have to know what's going on with me, just in case one day I'm not able to hang out with them, or one day I'm in the hospital. There have been times where I've run into a guy and we talked for a while, and once he saw the realities of this disease, he decided not to be a part of my life. And initially it hurt, but in the long run, I realized that that person wasn't meant for me, and he did me a favor. The person that I'm with now is very well aware of sickle cell disease. He knows how to care for me. He knows how to help me in moments where I am sick, and he's very supportive.
Oh, right now there's somebody that you have.
Yes.
He supports you.
Yes.
Does he suffer from this disease, sickle cell?
So he had the bone marrow transplant when he was 16 years old. So currently he is cured from sickle cell disease.
So you can be cured from sickle cell too?
Yes. There are multiple cures, but it's not for everyone. There is the bone marrow transplant, where you have to have a donor, 100% match. And there's new testing or new cures available, which is called gene therapy or gene editing, which you use your own bone marrow. You don't need a donor for that one.
Does this disease, sickle cell, has a relationship with malaria?
Yes. So initially the genetic mutation came about to prevent malaria in some people. What I currently know about the relationship between malaria and sickle cell trait is that if you have sickle cell trait and catch malaria, it may not be as severe as someone that doesn't have anything or someone with sickle cell disease. However, if someone with sickle cell disease catches malaria, it could be very fatal.
Is this your first time to be in Africa, in Kenya?
Yes, this is my first time in Africa, anywhere in Africa, so yes.
Okay, you have studied the weather of Africa, the weather of Kenya. It is a bit different with the weather where you're coming from.
Yes.
Maybe, are you feeling the symptoms of sickle cell right now?
At the moment, no. I do feel the cold breeze when it comes out, in the change in the hot and the cool. So sometimes I will have my jacket if it's too cold, even in the summertime, because we experience those cold moments. But at the moment, I'm not having any issues because of the weather.
Okay. And does the sickle cell, if you have a challenge of eyes, does it affect you with the disease of sickle cell?
With my eyes?
Yes.
Yes. So with sickle cell, the sickled cells can get in the back of the eye, which is called the retina, and it can block blood vessels. And if it's not watched carefully, the retina could detach and someone could go blind. For me, I see I see a retinal specialist every 6 months to a year to ensure that everything looks good in the back of my eye. I've had multiple laser surgeries to correct those blood vessels. Because of that, I see floaters and my vision is not the best, but I can still see.
And do you use medicines even right now?
Yes.
Do you take medicine?
Yes, the most common thing is folic acid, which helps the red blood cells in producing. There's also Indari, which is like a medical grade amino acid. It's your body is already adapted to that. It's just a high dose. But there are other treatments that can help sickle cell disease, like hydroxyurea, Adacvil, and Oxbryta. I personally have to be careful with those medications because they tend to increase the hemoglobin, which many people with sickle cell suffer from low hemoglobin. However, for me, my hemoglobin stays at a pretty high rate for someone with sickle cell disease. So if I take these medications, they could increase my hemoglobin even more and cause additional problems. They could have an adverse effect with me personally.
If you have a sickle cell disease, is there any diet that you are not allowed to use?
You should be careful on what you eat. For instance, sugary foods and fried foods cause inflammation, which could lead to pain. It's best that someone has a healthy diet full of fruits and vegetables and really research what foods help whatever issues they're having. So for instance, spinach is good with folic acid and vitamin B. Watermelon and cucumbers are very hydrating, so it's good to, of course, stay hydrated with fruits and vegetables that are good at hydrating and red blood cell production. So it can help having a certain cure, but it can help you manage the disease.
Maybe what can you be able to advise someone that is viewing you right now?
Stay positive, stay encouraged. It's great to have a good support system, someone who can help you and someone who is compassionate to what you're going through. Do not be ashamed of having sickle cell disease. This is not something that we got from being irresponsible, or it's not something that we cause ourselves. This is something that we got from our parents. So it's nothing to be ashamed of. It's best that you learn your body and learn your triggers. Learn what can make you sick and learn what makes you well. Learn what gives you energy in spite of the chronic fatigue. Learn what helps with pain without going to prescription narcotics and heavy medication. And it's best to keep inflammation down as much as possible.
Give us your final remark for the benefit of the viewers of Journey by the Grace mission.
Do not limit yourself because of this disease. You can do anything you put your mind to. Yes, it may cause issues, but at least give it a try so that you know what you can and can't do and what you can do to prevent crisis at some point. But don't feel limited because of this disease. There were a lot of people worried about me in this trip to Kenya because it's such a long flight. I've never been on a flight that long. It's a new experience, but I tend to look fear in the face and conquer it that way. I don't let fear or anxiety stop me from doing the things that I want to do.
Thank you so much for your time. We are much blessed to have you.
Thank you.
Maybe for the benefit of the viewers that would like to follow you, do you have the social media platforms where they can be able to attach themselves with you?
Yes.
Kindly give us your hashtag.
Yes. So on Facebook, you can find me at Sickle Cell Awareness 365. On Instagram, it's SCA 365.
Thank you so much for your time.
Thank you.